So I'll go ahead and go first. I am just going to be a background person. This is all about Ashlyn. So I am the project manager for community workforce programs at Montefiore Medical Center. Um, been here in my role for 3 years, with Montefiore for four. I had the pleasure of having Ashlyn as one of my interns for our Invest program, which is one of our pipeline programs that brings individuals from our other programs, such as FIPS Neighborhoods, Career Network, Healthcare, um, to provide additional training and a year of services where they receive career navigation held by me, as well as entry level experience, which they can then use to kind of build their resumes. And with no further ado, I pass it on to Ashlyn.
Yes, so I've been at Montefiore for it'll be 2 years, the ending of August. Within the 2 years, I had three different positions within the same department. So I started off as Elizabeth this day as an intern through Invest, which I was guaranteed a year. I worked here in customer service for a year. Then they had an open spot for a secretary in the office working hand in hand with the assistant director. So I got that position. And then from there, I moved up to be the supervisor of customer service with the assistant director hand in hand, and also including interpreting services along that.
That's awesome. Thanks, Ashlyn. So now that we know who you are, how about you tell us a little bit more about what your experience was? We know well, I kind of mentioned it, that you may have come from Phipps neighborhood. So how was your experience getting
Yes.
from there to here?
So I started with Phipps. We were the cohort right when COVID hit. So we were in the process of our externships being sent over to Montefiore and Calvary and NYP. Unfortunately, we couldn't do it because of the spread of COVID. So it was very sad, just because we were all looking forward to that. We had did all the projects, we had did everything we needed to do. So it was sad. So when COVID, I guess, died down, we can say, I reached out to Elizabeth and Dana and I asked, hey, are there any opportunities that I can continue to, get my foot into the hospital, as that was something I wanted to do. So that experience was great in itself. The people there were great. Elizabeth and Dana were just awesome. They were like God sent to get me here. So that was great. Then, started the Invest program. It was a little scary at first, just being in this position and, being in the hospital. There's certain things that has to be done, especially with HIPAA and all that. So that was the scary part of it. But they placed me in a department where it felt as a family. So I wasn't like, I felt like I was out of place. Everyone just welcomed me. And from there, it was all history.
Thanks, Ashlyn. So one big thing that I think I've seen throughout your growth here with Montefiore and just your career in general is really using your network. What kind of tips or advice would you give our young individuals here that are trying to kind of navigate their networks and how they should use those?
I always say, talk to everyone. I'm not gonna lie, there might not be people that that rubs you the right way. It happens. We're all human. We don't have to like everyone, but those people, you don't know who they know. I always say it's not what you know, it's who you know. So just always have a conversation. Always smile as you're walking down the hallway. I didn't really believe Elizabeth and Dana when they were saying everyone's always watching. No, they're really always watching. And then it's funny because when I got into the supervisor role, I realized like how they're always watching. Like, we're walking down, we see this and we see that, and we're like, oh wow, like that attitude we could use on our team, or this we can use. So just always be aware of your surroundings. I mean, you can't really smile through the mask, but smile with your eyes, smiles or something. Always, like when you're sending the emails, always make sure that you're using proper grammar, proper tenses and all that, so that they see like you're very articulate, you're very intelligent, you're very very detail oriented. So always don't burn bridges. If you're planning on leaving a position, always make sure you have that conversation with management, so that they understand, like, it's not that I want to leave, but it's just this better opportunity came. But maybe we can still work something out. We can be friends and we can partner on something later on. So just always make sure that you don't burn bridges.
Definitely. Thank you, Ashlyn. So I would also like to open it up to the floor. If any of our participants have questions, you're feel free to put them in the chat. I can read them off, or if you want to go ahead and unmute yourself, feel free to ask Ashlyn your questions. And in the meantime, Ashlyn, I just want to ask you, so you did mention that you started your healthcare career right at the start of the pandemic, and it was kind of scary. What kind of, so you kind of saw it before, while you were in program, you kind of saw healthcare before, and then once you were starting your career, you actually saw it during.
Right.
What kind of skills or kind of attitude or characteristics do you feel that individuals coming into healthcare have to have now, especially now that you're experiencing it as a supervisor versus an intern?
So have an open mind for everything. Things are always going to change. Things are still changing. I'm still getting emails now of things changing. Always have an open mind. Have a lot of patience. Even if, no matter what department you're in, no matter what department you get hired into, or your externship is, that patience is going to help you. It's going to be a very big key in everything. Also, just that initiative to want to do things, to want to put yourself out there, to want to take that leadership role. Sometimes it's not even you being a leader, it's you following that leader that is doing the right thing, that is going to show other people, like, wow, this person can really take direction. They're willing to do what they have to do to make sure the hospital's flowing the way it has to flow. So just being very open-minded and stuff like that.
That's awesome. Yeah, I definitely echo that. I feel that having gone through the pandemic, the idea of flexibility and taking that initiative where you can is so important. Because as we say here in HR, when you join healthcare, you're not the one that's running away from the fire, you're running towards it, kind of like a firefighter and things like that. Or don't join the army if you don't expect a war. So the same things in healthcare. So thanks, Ashlyn. I think that really echoed that. So yeah, go ahead for it. Go for it.
I was going to say, I have a bit of a cheater's advantage because I heard this great presentation from one of your colleagues at Montefiore, from Jenna, and was talking about the Montefiore's own expansion, but of course we know that there is a need for more healthcare workers generally, and wondering if you could both of you give some more context for people who have never, except in sort of the loosest sense, considered entering healthcare. Talk about some more of the other kinds of occupations that are in that people should consider, because I feel like so many people, they just think of like nurse and doctor, but not even within those categories, right? There are many different kinds, and there are so many other healthcare roles that are needed these days. So maybe just some quick context or ideas for people who are just trying to figure out, okay, what could I do in this space? What are the challenges? What are the opportunities? Anything in that area?
Yeah, Ashley, you want to go for it first?
Like you said, there's a lot of doctors and nurses here. Nursing is also categorized in different categories. So we do have RNs, we have ADNs. RNs are registered nurses. ADNs are basically the assistant directed nurses or managers. Then we also have our medical director, who does still practice medicine, but he also is in the office some of the time. So we have a lot of administrating work. So my department is customer service. So we have interpreting services. So those people that don't necessarily have English as their first language, we send out people to come in. Those people that need sign language interpreting, we do have that. Here we also have like a complaint department. So it's not that we don't, we really care about what our patients are going through. So we take all that into consideration. So if they have a complaint, they have any requests for help or anything, they can come here. and we'll speak to them, we'll help them, we'll get whatever we need to get done. We also have unit secretaries that work on the floors, that work directly with doctors and nurses, and they get that information of what to put into the system, which we use Epic. So what they have to put in, they have to do like transfer stuff, they have to make sure that every patient has a chart properly put in. We also have transporters who transport patients throughout the hospital. We have housekeeping who make sure that the hospital looks very presentable. They're the best. We have a cafe in the main hospital in Moses. So we have those people working, the cashiers there. We have the cafeteria where we have all the people that are working to make sure our patients are getting fed and family members are getting fed. We also have like a caregiver support center here in the hospital. So that's really where families go. They get that support that they need from the team of the patients. And we also have an international office. So those people that are coming from different countries or different places feel like they have a home here in the hospital. So we have that location for them as well. And they all work hand in hand with patients, hand in hand with doctors and floors and stuff like that. So there is a lot of different opportunities here in the hospital.
Thank you.
That was like perfectly said, Ashlyn. Thank you. And I just wanted to add, if any of our young people here, or really it doesn't matter, if you ever want to figure out if healthcare is for you, our hospital has volunteer services. So you're able to volunteer. We'll put you in places like our child life, our nursing units to kind of be a friendly visitor to our patients. Also, some of our lobby work is volunteer work. So you kind of get to meet the whole gamut of all of these different occupations if you're so interested.
If there are any links that you want to put in the chat for people so they can learn more about these programs or to contact you, or really anything that's a useful resource. I know it's easy to get information overload with all the opportunities out there. But soft video. But importantly, not only is Montefiore growing, but their healthcare jobs are a bigger share of the economy in New York than nationally. And if I'm correct on the latest data, it's also growing faster in New York than it is nationally. So many opportunities in many different areas, which is excellent. Oh, I see a question in the chat. What exactly does the volunteer work mean?
Yeah, volunteer work means that you come in and essentially you're completing tasks. It's not somebody's job or anything like that, but you're coming in and you're completing different tasks that kind of give you an experience of what healthcare is. In some of our, for example, for friendly visiting, bringing water and reading materials to our patients, making sure they're okay, assisting nurses, like if they need certain things filled or filed, you're there to help them out. In our lobbies, it's kind of helping our customer service team escort patients. Maybe they need help getting to the second floor and a certain department that's up there. You're assisting them in doing that. You also can get administrative experience, so helping some of our administrative individuals in our different clinics kind of file paperwork or even develop educational outreach boards of different health things that you should keep in mind, whether it's preventative or maybe it's things like even just getting a vaccine. So there's different levels of creativity that are available in volunteering. But of course, it is on your free time. If you have like 4 hours to give one day, you're able to kind of let us know, and like we're able to set you up. I will say that our volunteer onboarding process is a little bit more complex just because we are a hospital, so we want to make sure that you're in your best health to help our patients. But yeah, I hope that answered the question. And actually, Ashlyn, did you get to volunteer with us before you got your internship?
So I also had a child before I was able to.
That's true.
So I couldn't. That's why we did the invest.
Definitely. So then we have another one in the chat. Is it possible to get a job at the hospital without a degree and stuff? Most definitely. That is something that our department is very, very supportive of. is giving everybody their entry level, right? And our organization as a whole, there are many entry level positions. Ashlyn, is there anything you want to share on that note?
So, like you can come in, let's say you just have a high school diploma and you start your entry level job. That's great. Once you start, a lot of our entry level jobs are $11.99. So $11.99 after being in here for a year will pay for you to go back to school if it's affiliated with healthcare.
Yep. Ooh, can we explain 1199? Yes. That is actually our union. So what a union is, it is an organization that kind of looks out for the associates, has certain contracting with an organization to provide certain benefits to employees. In this particular union, one of the benefits that they have contracted with Montefiore for the employees is to get additional education. There's also things like tuition reimbursement, childcare, and a few other ones that I'm not as well versed, but I think Ashley could probably fill in some blanks on there. But yeah, I think that's it. Or unless you want to add.
They give insurance, they give dental, they give medical insurance. They give a lot of other things that you might those things that you think you won't get if you just go and speak to a delegate. Delegate is someone who works for $11.99 and will fight for you as the union should, and they will give you all the information that you will need.
Yep. And it's not to say that even as a regular associate, because some of our positions, for example, my position does not fall under 1199. Or once you hit like certain manager levels, you're not 1199, but you are protected by the organization. There is additional benefits in that. We do have tuition reimbursement for our regular employees as well. So definitely continue to help you grow through your career is something that Montefiore really supports, and healthcare in general. And it's important to remember that. Oh, I was looking at the chat. Sorry. No, I was saying, yeah, Famita, if you ever want to come down to the hospital, I'm gonna go ahead and put our volunteer website link. You can go ahead and apply through that link. It'll just require things like your resume, general information. Then you'll get a video link to do an interview. It'll ask you a couple questions that you get to answer on the spot. Then our volunteer personnel will kind of help you find the best spot for you. So what matches your interests, and then connect you to managers and see how it goes.
And what are the areas you would say where, for people who are totally new to healthcare, no experience in this, what are the areas where maybe the best opportunities, besides just volunteering, of course, best opportunities for getting one's foot in the door for the whole healthcare industry? And if the answer now is different than what you expect the answer to be, say, in 2 to 3 years, because it's very changing time, then totally I'll take 2 answers.
Sure thing. Ashlyn, do you want to go first, or you want me to go first?
So definitely customer service. As long as you have customer service on your resume, anywhere you go, hospital, anywhere outside of hospital, it looks really good on you. And also, you guys will be working with me. So customer service is a very big one. Also, housekeeping, just to get your foot in, will be very good. Once you guys are in, there's an app on our computer that you can just apply for other jobs. We'll just get your foot in. So I would say customer service, housekeeping, any cafeteria jobs, stuff like that would be really good to get you started.
And I totally agree with that. And then I definitely think that this is something that's gonna continue as healthcare goes on. As Ashlyn mentioned in the beginning, it's all about who you know, not necessarily always what you know, right? So you might be new, you might be fresh out of high school, and just starting out. Being able to make those connections early, so through things like customer service or maybe food service. We have a cafeteria, we have individuals that do our cashiering, we have servers, things like that. I've had friends that actually start there. They become great friends with directors and things like that, or even just fellow associates, and they figure out their career path. There's people that have gone from serving to being nurses, to being directors, to being vice presidents. So it's definitely the main point is just get started. Start with these entry level roles, even if it's an administrative assistant role at your local clinic. Maybe you like the job that your nursing staff at your pediatricians or your doctors do. Taking the time to ask them like, hey, I'm really interested in your job. Can I shadow you one day? That can also lead you to additional opportunities. Like maybe they'll take you on for an intern. Um, maybe there'll be an opening at some point and you'll be considered. So just taking those chances.
And out of curiosity, I was just peeking on Montefiore's jobs page and see that just this random point in time, there are 1,268 openings officially for Montefiore. So when you say that there are a lot of opportunities available, it is a lot of opportunities.
Yeah, definitely. And if you're concerned about that part of like growing your network, right? The oh no, the who you know part. You now know us. You know Ashlyn and I, you know community workforce programs. So you're more than welcome to reach out to us and say, hey, I sat in your webinar, your presentation, and I really enjoyed what I heard. I'd love to keep up the communication. And we're happy to help you along the way however we can.
What's the best way for people to contact you?
Definitely. I'm about to put in the chat. I'm going to give you our direct line here at Community Workforce Programs, as well as our email address. Email is probably easier. All of our team sees that, so we're able to get back to you a little bit faster that way.
And I know we have a lot of other people in the room. If anyone hasn't asked questions, we do have a bit more time. So I want to make sure that we get everyone's questions asked. And of course, if anyone has questions afterwards, can send them to Ashlyn or Elizabeth. But want to cover as much as we can today, either about Montefiore specifically, healthcare generally, or how to, if one's already been thinking about healthcare, can even be more specific questions about particular paths, for instance.
Awesome. I just put our contact information in the chat for you all to refer to. Well, you guys are thinking of your questions. I'm going to go ahead and throw a question out. Ashlyn, did you always think that you wanted to be in healthcare?
No, I wanted to be a teacher. I wanted to be a teacher for babies, for like, you know, from birth to second grade. Then I started like my career path went from working in fast food to then working at a medical supplies office. And from there is when my growth for like healthcare became, and that's when I started FIPS and learned a lot more about it. And then from there, after seeing what I saw in the hospital, I wanted to stay.
That's awesome. Thank you for sharing that. I can definitely relate. I too was not someone that was going to come into healthcare. I always tell people I wanted to be a Disneyland performer, the ones in the suits. That's what I wanted to be. But everything built up was pharmacy technician, and then wanted more. So I got my degrees. I got this role actually through an internship. I was doing diversity and inclusion before this. And through just working with community workforce programs and completing a few projects, they invited me on to their team. So again, going back to that, who you know, right? As long as you're showing up and you're taking that initiative, you never know where it's going to lead you. Awesome. I think we're coming up about time soon. If anybody has any questions, feel free to shout them out or write them down.
One last question I have, if no one has any questions, and this is for both of you. What was the most surprising thing for you after getting into healthcare, from between your expectations of what it was going to be like and what it was actually like?
So I watched a lot of Grey's Anatomy. So I thought it was like that, honestly. I was just like, okay, so everyone's just gonna know everyone and all that. I thought that we were gonna have like really unwilling people to like want, especially being in the Bronx and, you know, have being raised here, just knowing how the atmosphere is sometimes. When I started, it was completely different. Everybody was very welcoming. I went up to like the higher ups here and I spoken to them just as a regular red coat, and they were great. Like they were very respectful. They didn't treat me any less than what, because they were in a higher position. They didn't do that. I didn't, on my first day, I didn't expect to see what I saw. So I had, there was basically like a street called in the lobby. So that was a bit scary, but I think seeing that made me want to stay more, just because I was able to help someone get better.
Cool. So my expectation, I am very much an office person. So as much as I love people, so I came into this role, I'm like, I'm gonna break out. I'm gonna be more social, things like that. And something that really like surprised me was the difference you can make. Um, I always just thought like rules, processes, papers, like that'll make a difference. But like when you see, for me especially, like when I see students like Ashlyn, that started out and like I just got to work with her, I think it was a month ago, and she got to tell me what to do. That was like the greatest thing ever. Or like hearing students come back like, yeah, I didn't believe you when you said this, but now I applied it and it actually worked. So it's kind of, that's like surprising thing. And I think I even experienced that when I actually got to work during the pandemic. I was redeployed to the front entrances, so I got to work with Ashlyn for a few weeks. And even seeing the difference that you can make in a visitor's life, just in those few seconds of, yeah, you told them good morning. That could be like the whole switch from, I was having a horrible day and I had to be here at the hospital, but now that you told me good morning, that's a difference. So I think just the sense of the difference. You have this idea like, yeah, I like making people happy, or like, yeah, I can make a difference there. But until you do it, I think you don't know the magnitude of it.
And I think that is a perfect spot for us to end. So Ashlyn, Elizabeth, thank you both for joining today. Thank you everyone else for attending the session. Again, make sure you get everyone's contact information. And if people have any questions or thoughts later, send to me, Ashlyn, or Elizabeth as relevant, and we'll get you all the information we need. And I'm going to close the session, but before I do, want to make sure people click on that link to go to the lobby so they don't get stuck. And we'll see you in a few minutes. Thank you, everyone.
Awesome. Thank you, everyone.